Hello, my name is Nata Clasion, and today I'm going over a project I did about a year ago, April of last year. I looked at the video again and I realized that the presentation needed some improvement because it was a little bit crammed, so I've spaced it out and made it a bit more absorbing. And at the same time, I showcased to you some of my PowerPoint skills. Here it is. Basically, as a refresher, we're looking at the relationship between living alone and mental health outcomes. I'm using Torontonian data from the census of 2016. So this project is basically looking at if there was a relationship between the rates of living alone and the rate at which people in different Toronto communities are admitted to hospital for mental health or addiction related reasons. So my hypothesis is saying that what I'm claiming is that elevated rates of living alone in communities leads to a higher prevalence of mental health related hospitalization. So anyways, in this data project, I used 2016 census data from Toronto, looking at hospital admissions and housing conditions. Yeah. So, hmm, the statistical methods I use are, just to go over them roughly, regression tables, regression equations, confidence intervals, null hypotheses, etc. The null hypothesis, I will get to this later, but I'm making a 95% confidence interval for the difference between the means of two different communities or two different groups or variables, which is those who have the communities that have above average hospitalization rates for mental health and those that have below average rate. So if the difference between them, if zero is on this confidence interval, then we can say that the potential that there is no difference between these communities for living alone uh, is uh, i- is there on the confidence interval. So whereas if zero is not on the 95% confidence interval, then that's an indicator that the difference between these communities' um, hospitalization rates can be explained by our explanatory variable, which is the living alone rate. So what I did, I just went over the response variable and the explanatory variables, but the explanatory variable required some data wrangling because there was not a precise variable measuring living alone rate. So I took the column in that data set titled total population in private households living alone and divided it by the total population in private households. So this variable I called the living alone rate. So here is some of the code from Jupyter Notebook, just showing what I did. I imported the important data packages for visualization, wrangling, plotting, and then I read the two data sets, hospital data and living alone data. I read them into an Excel file, um, and then I selected the columns I was interested in from the hospital data set because I'm only interested in a few of the columns for the purpose of this project. Then I created a new data set called Hospital Analyze with only these selected columns. And one thing I did towards the bottom is I renamed some of the columns using a dictionary because some of the columns didn't have the names of the columns were difficult to understand. Unnamed zero, you don't know exactly what that means unless you look at the data beneath that column, which will indicate to you that it's some sort of neighborhood or community ID. So I actually renamed that to neighborhood ID. Unnamed one is the neighborhood name, so I renamed that as well. So hospital analyzed two, that's our final data set for the hospital data, and it takes into account the columns of interest and has renamed them as well. So importantly, what I did was I merged the two data sets using the dot merge function. And I merged them on the shared column between them, which was the neighborhood ID column, community ID. I also used the dot hist function to make sure that in both my data sets there was no outliers or missing variables, so I could clean that up. And then I went on to create a scatter plot using 50 a sample of 50 of the data points from the total of 142. So the data points, each one represents a Toronto community, just to be clear. So this is a way for me to visualize the information for my variables. I also have a statistical summary, which I'll get to. But oh, here, well, this code here, what is going on is I'm taking the data set for living alone, and I'm selecting again the columns of interest in that very first line. So this new data set, living alone new, will take only these columns of interest from the original data set. And then I use a dictionary again to change the name of the columns to make them more easy to understand. And well, that's my final data set for the living alone data. Living alone 2 is its name. And in this next rectangle square tab, I merge the two sets. I merge hospital analyzed data with live alone data 2, and I merge them on the neighborhood ID. That's what the right on and left on represent. They those that column neighborhood ID is shared between the two sets. And then I select my columns of interest from the merge data set, and merge new is basically representing the merge data set with only the columns of interest. And by the way, I create a new variable called merge new living alone rate, which is the total, as I said, the total population private households taken from the merge data set divided by just the total population in general. So I created a new column called the living alone rate, and that's how I did it right there. Um, but anyways, I made a scatter plot with my explanatory variable on the x-axis, the living alone rate column, which I just created, and on the y-axis, the mental health related hospitalization rate. So up here you can see how I put in the column names from the merge data set to create the scatter plot, title, XY label, some of the centering for the labels. These are just numbers for that. And I imported OLS so I could create a line of best fit to give me an indication of how the direction of the relationship and the strength of the relationship as well. That's what the line of best fit here is showing. So for my input, I just put in the variables, the two columns from my merge data set, and that gave me the line of best fit here. One thing I also added was a descriptive line, or sorry, descriptive um, title underneath the figure, describing to us that there is a strongly positive correlation line. I thought that was important. So, well, I also created well, the code for this is not visible, but I created a summary table for the line of best fit that tells us the coefficient slope coefficient and the intercept. So the living alone rate coefficient here, 13.2897, let's just say that's 13. What it's telling us is that for every 1,000 people who are living alone or single person household added to this data set, um, for every new 1,000, we can expect 13 among them to be hospitalized for mental health or addiction related reasons. The intercept is telling us if none are added, the initial amount being hospitalized is 3. And then the standard error for the living alone rate is 2. If we move towards the last two columns, the 2.5 percentile and the 97.5 percentile, that's telling us the 95% confidence interval because the difference between them is 95%. So on that 95% confidence interval, we have between 9 and 17. So for every 1,000 people living alone added, between 9 and 17 of them will be hospitalized for mental health or addiction related reasons. We can say between 9 and 17 of them will be hospitalized with 95% confidence interval. You know, that the amount hospitalized will fall between those two numbers. So, is there a statistically significant difference among households? And here is where I use bootstrap mean samples, repetitive samples of the mean to calculate if average hospitalization rates for mental health issues differ among single person household, non-single person household. So the line of code here, the first thing I do is I create a new column that's either going to be having a label for each community as yes or no. And from the merge data set, if the living alone rate is above 19%, which is the median, then yes, they have an above average living alone rate. Okay. It's a descriptive variable. This actually what it's going to be telling us its output is descriptive. It's a yes or no. It's not a number. And if their living alone rate is below 19%, which is the median living alone rate among 142 of the communities, if it's below then we're not above the average living alone rate. So our label is no. So what I do towards the bottom is I take repetitive samples, size 50, for both communities, for both groups, those that have above average rates and below average rates. And I do this repetitive sample of 50 5,000 times and calculate a difference. That's the bootstrap mean portion here. So we take the mental health admission for the sample mean 1 and sample mean 0. These are the labels for the yes and no groups. And for I in range 5,000, this is repeated 5,000 times. And it's put into a list. And this list is carrying the difference between the groups that are above average and below average, the difference of their means. Sometimes it could be 0. 0 would indicate that there is no difference. So here is a histogram plot. I take the list titled Bootstrap Means. I have the size of the histogram, 50 bins. Um, and I move from the 2.5th percentile to the 97.5th percentile. In this histogram here, let me explain clearly what it's doing. It's the difference of the means. So we took the difference, so we take the mean from the group that has above average rates of mental health hospitalization. Sorry, let me go back. Above average rates of living alone and the mean hospitalization rate for those that have below. And then we take the difference several times. And this here is representing the difference. So, for example, if we go to the number two, this is a density plot. So some significant percentage of those numbers in the list were two or greater. So the difference between when we took the difference between the means, there was a lot of times where that difference would be more than two. So, um, in conclusion, I think that part is a little bit complicated, but my project has aimed to analyze if there is a relationship between rates of living alone and mental health addiction related hospital rates in Toronto communities. I'm just saying that as a refresher. That actually, this past thing, what it's done is it's taken a 95% confidence interval of the difference between the groups with above average living rates of alone, above average alone living rates, and then the group below average alone living rates. It takes their difference between those two groups, their mean difference, and then it puts it into a list, and then it does it again, and it does it again, and it does it again. So that list has 5,000 different elements between 0 and whatever the biggest difference would be between those two groups. So remember, as we said, the null hypothesis was if 0 is not on the 95th percent confidence interval, we can reject the null hypothesis and say the difference between the communities for mental health hospitalization is being caused or is being affected by our explanatory variable. So, and basically, as you can see on the this distribution graph, this histogram, the 0 is below the 2.5th percentile. So it's outside of the 95th percent confidence interval. That 0 means the difference between the two groups is 0. So Well, let me explain in the conclusion why we reject the null hypothesis. Based on the regression plot above and slope of regression equation, there seems to be a clearly positive sloping regression line for the correlation. Okay, and as I explained, higher rates of living alone among private households correlates with higher rates of mental health related hospital admissions. So, based on the slope, for every 1% increase in the living alone rate, the number of people admitted to hospital for mental health reasons increases by 13 per 1,000. Okay. And then figure three is telling us that based on the median, there's a clear difference in average mental health admission rates between the two types of communities. Figure three was the histogram. So our 95% confidence interval does not contain zero as the possible difference. So the null hypothesis here is rejected. So we can say with 95% confidence that the mean difference in communities with above and below average living alone rates is between zero point 0.1 and 3 people per 1,000 admitted to hospital for mental health reasons. Anyways, there's some limitations to my project which I'd like to briefly talk about. There are potentially confounding variables such as age distribution in communities. This is simple. Some communities have a higher median age. So if there are more old people in the community, there will be an underlying variable affecting both my explanatory and response variable. So we can see a scenario in which a lot of senior people are living alone. They don't have anyone to care for them. And a lot of senior people are dealing with mental health issues too, because there is a higher incident of cognitive decline amongst them, injury, and things like dementia. So another limitation is income levels. Income levels affect both how people are, how many people you're living with, and your mental health. Though there might be a reverse relationship here. Maybe lower income levels means you are living with more people, but potentially facing more day-to-day stress, more mental health issues. And physical health is also very important. So some communities have reduced physical health. Maybe they are closer to factories that emit carcinogens, so they might have higher rates of cancer. And these reduced physical health levels could underlie some amount of social isolation, and of course, it will affect their mental health and addiction levels. So the study is cross-sectional, so it's taken for a single point in time. So time could also be a confounding variable. Um, and a big limitation is that my living alone variable does not precisely measure such. Instead, it's focusing on living alone among private households. Um, so private households and living alone, the thing there is that we're looking at a different income group entirely than people that are living alone in apartments. There's all sorts of living alone situations. So other private household related factors may further affect my study. And next time it would be wise to use panel data, so data over a few years rather than 1 year. Um, some years are outliers. Some years have events happening that affect both variables. Um, and it's also good to find a precise living alone variable and consider the income of different communities in my analysis. So, thanks for listening. That concludes my